The purpose of Forza Screen Recovery House is to provide a 2-week stay which acts as a stepping stone between the acute mental health environments that most of our residents come from and moving them on to some kind of independent living, whether it be their own flats, their own homes, or some kind of supported accommodation. Letting people be independent enough to go to the shops, to help them do their own cooking, take care of their laundry, keeping their rooms tidy, the kind of everyday skills which we take for granted, but if you're suffering from mental illness can become more of a challenge.
I found the recovery house an important stepping stone, because if there wasn't this place available, I would have left the psychiatric ward and gone directly to probably a bed and breakfast or somewhere that might not have been suitable to my needs.
Back on Track is aimed at people with low to moderate mental health issues. As it sounds, it's just to get them back on track, really, in life.
I'm closer now to being where I wanted to be than when I was 7 months ago, where I didn't have no hope of ever changing my life and my circumstances.
It's just so nice to see people sort of rise from low depression to recover a better quality of life, really.
And if more workers were like my worker, it make you feel like you can rely on them and trust in them, you can come a long, long way by using the service.
The perinatal psychiatry service is a service for young women under 25 who are pregnant or new mothers, and it offers community-based activities.
The perinatal psychiatry service was developed following my partner being admitted to a mother and baby ward about 2 years ago.
There is a particular need at this time for a service, especially with this age group, because they can feel particularly stigmatised for being pregnant. Again, there's the risk around pregnancy because it can be a trigger for mental health problems, and also if the young people, like I say, feeling stigmatised, that can exacerbate the situation as well.
IAPT, Improving Access to Psychological Therapies, is a cognitive behavioural based therapy, quite prescriptive and structured, which helps people to look at their thoughts and feelings, emotions, and helps them to maybe think about changing their behaviours in a way that will help them to feel less psychologically distressed.
Treatment's been coming from two angles, really. One has been support from Julia in the help of finding me goals, what do I want to do, what would help me, and really find me a sort of area that I was good at, to bring out the best in me. It's a new way of thinking. What you have to do is train your own mind and sort of train your own thoughts to really not look at all the negativity, but look at the positive sides of things as well.